Bismillahirrahmanirrahim. Assalamu alaikum everyone. We will be discussing today the diabetic neuropathy and the role of microbiology. And we have with us an esteemed speaker, Dr. Adnan Riaz, who is the assistant professor at the Islam Medical and Dental College, Sialkot. And he will be sharing with us his experiences and insight on the subject. So without much ado, Dr. Saab, the session is over to you.
Thank you very much, madam. So today we will discuss the diabetic neuropathy and role of the vitamin B12. My name is Dr. Adnan Riaz, and I'm working in Islam Medical and Dental College as assistant professor. So let's start.
Thank you.
Bismillahirrahmanirrahim. So today's topic is the diabetic neuropathy and the role of the vitamin B12. So, as we all know, the diabetes mellitus. What is diabetes mellitus? So, definition हम सब लोगों को we all know that diabetes mellitus is a progressive disorder which is basically due to the deficit in the insulin secretion and or its action. Okay? That is might be due to the insulin resistance. So, about the prevalence of the diabetes mellitus, about 425 million adults in all over the world are suffering from the diabetes mellitus right now, and the approximate increase up to 2045 is about 629 million people. So it's a huge burden, or it's increasing in most of the countries of the world. The 79% of the adults with diabetes were living in a low and middle class income countries, while in the largest number of the people with the diabetes were between the 40 to 59 year of age. And the most astonishing thing is the 1 into 2 person were undiagnosed now. So we have to rethink about the our cultural habits और अपनी dietary habits को और अपनी lifestyle को जो है वो rethink करना पड़ेगा. So then diabetes used to 4 million deaths all over the world, and expenditure is about $727 billion of the health expenditure is about 12% of the total expenditure of the adult. About more than 1 million people are living with the type 1 diabetes at the time, or 21 million live births were affected by the diabetes during pregnancy. And if I'm talking about the Pakistan, 17.1% there is prevalence of the diabetes in Pakistan, which is about 148% higher than the previously reported. In 2019, in 2019 there were about 19 million adults in the Pakistan were estimated to be living with the diabetes. 2016-17 में वाइड ने एक सर्वे करवाया था, नेशनल वाइड सर्वे विच इज नेम्ड एज सेकंड नेशनल डायबिटीज सर्वे ऑफ पाकिस्तान. सो उसमें जो प्रेवलेंस नजर आई थी, इट इज अबाउट 26.3%, विच इज फार मोर हायर देन द गिवन बाय द IDF. जो IDF का डाटा है, 9th एडिशन जो है उसका IDF एटलस जो है, डायबिटीज एटलस जो है 9th एडिशन, उसमें 17.1% था. वाइल इन 2016 और 17 में जो बाइड ने सर्वे करवाया था उसके हिसाब से इट्स अबाउट 26.3% प्रेवलेंस है पाकिस्तान में, विच इज अ ह्यूज नंबर. ठीक है. सो वी नीड टू टेक मेजर्स अगेंस्ट द टाइप 2 और टाइप 1 डायबिटीज. और डायबिटीज के खिलाफ हमें जो है वो एक जिहाद शुरू करना पड़ेगा जिस हिसाब से ये इंक्रीज करे. यू कैन नोटिस हियर दैट 148% हायर देन द प्रीवियसली रिपोर्टेड. ठीक है. तो इतना इंक्रीज, मेजरली इंक्रीज हो रहा है इसका हमारे इधर कंट्री में. सो वी नीड टू टेक अ वेरी गुड केयर ऑफ द डायबिटीज इन सेंस ऑफ आवर सोसाइटी. देन अबाउट द complication of the diabetes, there are certain macrovascular complication, there are certain microvascular complication. There can be a diabetic retinopathy, stroke, cardiovascular diseases, neuropathy, nephropathy. These are all the complication of the diabetes. But our focus for the today's is the diabetic neuropathy. हम neuropathy पे हम हमारा ज़्यादा focus रहेगा, लेकिन जो चीज़ आपको बतानी है वो ये कि इट्स अ लॉन्ग स्टैंडिंग डिजीज और इसकी सीवियर कॉम्प्लिकेशन there might about 70 to 80% of the people having diabetes mellitus, they will ultimately suffer from the cardiovascular diseases. Neuropathy, nephropathy, these are all the common complications of the diabetes. Then there is a difference between the neuropathy and the nerve compression. There are the people suffering from the diabetes may have the two different types of disease. It can be a peripheral neuropathy or a multiple involvement of the nerve, which is known as polyneuropathy, or there can be a mononeuropathy, which is due to a nerve compression of a single nerve. So there can be a multiple involvement of the nerve known as polyneuropathy, or there can be a single nerve compression. We will talk about the types of the neuropathy involved in the diabetes. So we will talk it later on. So polyneuropathy, diabetic neuropathy is majorly neuropathic disease, a peripheral neuropathic disease है, ठीक है, and the sign of the symptoms are tingling sensation, burning of the feet and hand. So these are all the symptoms and features of the neuropathy. Diabetic neuropathy की अगर definition की बात करें, so it can be defined as the presence of the symptom and sign when other causes have been excluded. जो न्यूरोपैथी की दूसरी causes हैं, अगर हम उनको exclude करें तो उसके बाद हम उसको जो है वो we can label it. If a patient is suffering from diabetes mellitus, then we can say that it is due to the diabetes and this is the diabetic neuropathy. Diabetic neuropathy में so peripheral neuropathy is a very common prevalent. About in a one study it has been quoted that about 40 to 50% of the people with the long-standing diabetes will be suffering from diabetic neuropathy. While in another study it has been quoted that about 60 to 70% of the people have the mild to severe form of the neuropathy, either in form of sensation, pain in the paired sensation or pain in the feet or hands, or there can be autonomic involvement like digestion impairment, slow digestion of the food in the stomach, or there can be bladder involvement. So there it has a very wide range of the symptom as well. So about 60 to 70% people of the suffering from the diabetes will ultimately suffer from the polyneuropathy or diabetic neuropathy. 70% of the diabetes have lost sensation in their feet, or about these 70% will have due to their diabetic foot, due to involvement of the nerves of the feet, they can form the diabetic foot ulceration. So there is, as I have mentioned there, that the 70% of the patients suffering from the diabetes will have loss of the sensation in their feet, and this ultimately leads to the diabetic foot ulceration. And about 25% of the diabetic who have developed the foot ulcer, इनमें से ये जो 70% जिनको न्यूरोपैथी डेवलप होती है, उनमें से तकरीबन 25% जो people हैं, they can have the foot ulcer, ठीक है, and more than half of the all foot ulcer will become the infected, और उनमें से 1 in 5 required an amputation, ठीक है. So ये जो 25% डायबिटिक जिनमें फुट अल्सर डेवलप हुआ है, उनमें से 1 in 5 जो है उसकी एम्पुटेशन जो है वो अल्टीमेटली हो जाती है. और जो उससे भी एस्टोनिशिंग थिंग है, अबाउट 30% ऑफ दोज पीपल जिनकी एम्पुटेशन हुई है, दे विल हैव अ सेकंड लिम्ब एम्पुटेशन एज वेल इन द 3 years, ठीक है. और 5-year mortality rate of limb amputation is reported as high as 74%, which is greater than the colorectal, breast and prostate cancer. लेकिन इससे भी एक astonishing thing is that about 75% of the amputation can be preventable. So we can prevent the amputation by early detection, early management के साथ जो है वो हम इसको जो है वो prevent कर सकते हैं. So Why I'm focusing on this? Because neuropathy is a very common phenomena in our society. और 70% of the diabetic, जिस तरह मैंने जिक्र किया, they will have the loss of sensation in their feet, और फिर ultimately ये आगे चल के amputation, और उसके बाद एक डायलेमा है amputation, और उसके बाद जो उसकी mortality rate है, it's very high, यानी even it is more than the colorectal, breast और prostate cancer से भी ज़्यादा है. But this is a thing which we can prevent. ठीक है, अर्ली डिटेक्शन, अर्ली मैनेजमेंट से हम इसको जो है वो प्रिवेंट कर सकते हैं. तो नाउ दिस इज ओवरऑल एक आपको व्यू देना था. उसके बाद हम वी विल टॉक अबाउट द रिस्क फैक्टर फॉर द डायबिटिक न्यूरोपैथी. सो उसमें देयर आर मल्टीपल फैक्टर्स आर इन्वॉल्व. द टू मेजर फैक्टर्स व्हिच आर इन्वॉल्व इन द डायबिटिक न्यूरोपैथी आर द ग्लूकोज कंट्रोल एंड द ड्यूरेशन ऑफ द डिजीज. ठीक है, ग्लूकोज का कंट्रोल अच्छा नहीं है या ड्यूरेशन ऑफ द डायबिटीज जो है, ये दोनों जो है वो मैटर करती हैं. अल्टीमेटली सबसे ज्यादा मैटर करती हैं फॉर द डेवलपमेंट ऑफ द पॉलीन्यूरोपैथी, फॉर द डेवलपमेंट ऑफ डायबिटिक न्यूरोपैथी. सो डायबिटिक न्यूरोपैथी की डेवलपमेंट में द टू मेजर फैक्टर व्हिच आर इन्वॉल्व आर द ग्लूकोज कंट्रोल एंड द ड्यूरेशन ऑफ द डायबिटीज. देन there can be a damage to the blood vessel due to, this is also basically due to the glucose control. If you have hyperglycemia, there will be endothelial damage. If there is endothelial damage, there will be impaired blood flow to the vessels as well as the nerves, which will lead to the ultimately lead to the neuropathy. Then there is mechanical injury to the nerve also plays a role in the development of the diabetic neuropathy. Then autoimmune factors are also involved, the genetic suspicion, and finally the lifestyle of the person. So lifestyle modification or lifestyle habits जो है, smoking है, alcohol induction है, ठीक है. So these are the major factors which can play a role in the development of the diabetes. So let's have a look why there is a diabetic neuropathy develops due to this. So the major phenomena here is the involvement of the nerves. Demyelination होती है. Why this demyelination happens or injury to the nerve happens in this whole scenario? Basically due to the certain factors, due to the hyperglycemia, इसकी मैं आगे जाके बात करता हूँ, ठीक है. So due to the certainly impaired blood flow to, there is impaired blood flow to the vessel, there is decreased blood flow, decreased myelination and destruction of the nerves. जो है वो myelin की जो है वो myelin sheet जो है nerves की, this will be destructed and there will be ultimately production of the neuropathy. और neuropathy जो है वो diabetic neuropathy के form में जो है वो आगे जो है वो present करती है. ठीक है, तो mechanism इसका क्या है? So let's have a brief look on the mechanism of the development of this whole previous picture. इसमें ये क्यों myelin sheet जो है वो डिस्ट्रक्ट हुई और क्यों जो है वो blood vessel की जो है वो decreased blood flow होता है इस सारे process के अंदर. ठीक है, so the first of all, if there is a hyperglycemia, this hyperglycemia will lead to the advanced glycosylation end products. So advanced glycosylation precursor जो हैं वो ज़्यादा बनते हैं. Then there is increased protein kinase C production. Then there is hexosamine pathway will be increased, and these all three things will lead to the oxidative stress. ठीक है, these all three produce the oxidative stress. Then this hyperglycemia also there is increased glucose. We all know this glucose will convert it into sorbitol. While converting this glucose into the sorbitol, the NADPH will be converted into NADP. This NADPH is decreased. ठीक है, अगर ग्लूकोज सार्बिटोल में कन्वर्ट हो रहा है, when it is converting into sorbitol, so there is basically decrease of NADPH. ठीक है, क्योंकि वो NADPH जो है वो NADP में इस सारे प्रोसेस में जो है वो कन्वर्ट हो रहा है. So this NADPH, as there is decrease in NADPH, so there is decreased nitric oxide synthase. ठीक है, nitric oxide synthase will be decreased, so there will be decreased NO and nitric oxide will be decreased. Due to decreased nitric oxide, there is decreased blood flow, because we all know that nitric oxide is a very potent vaso active agent. ठीक है, deficiency of the nitric oxide will lead to vasoconstriction. So when there is deficiency of the nitric oxide, there will be decreased blood flow, and due to decreased blood flow, there is ischemic damage of the nerve. There will be axonal loss and demyelination. So यहाँ पे जो है वो one thing is the oxidative stress, then the other thing is the axonal loss or demyelination. Then the other thing is the sorbitol. Sorbitol दो तरीकों से जो है वो एक्ट करता है. One is it is osmotically active particle. So as it is an osmotically active particle, it can physically destruct the cell. ठीक है, ये नर्व सेल को फिजिकली भी डैमेज करता है बिकॉज इट इज एन ऑस्मोटिकली पार्टिकल. तो ऑस्मोटिकली एक्टिव होने की वजह से ये वाटर को सक करेगा और उस वजह से जो है वो आगे से उसकी जो स्वेल अप होने की वजह से सेल जो है फिजिकली डैमेज होता है. अदर थिंग, ड्यू टू इंक्रीज सॉर्बिटोल देयर इज decreased myoinositol and decreased nerve growth factor. ठीक है, so when there is decreased myoinositol which is required for the synthesis of the myelin sheet, so there is decreased myoinositol, there is decreased synthesis of the myelin sheet, and there is ultimately diabetic neuropathy. So there are three major factors: the oxidative stress, there is axonal loss and demyelination due to decreased nitric oxide synthase, and there is increased production of the sorbitol, which is ultimately lead to decreased myoinositol and leads to diabetic neuropathy. So these three things will lead to diabetic neuropathy. और यही इसी चीज को फिर दोबारा से यहाँ पे प्रेजेंट किया गया है कि there is free radical, glycosylation end products, polyol pathway, deficiency of nerve growth factor, inflammatory process, or protein kinase C. Is all produced due to hyperglycemia, and due to hyperglycemia there is production of the neuropathy. ठीक है, and then this neuropathy will ultimately lead to change in pain perception, autonomic, vascular, renal and retinal neuropathy, and pain and sensation on the touch and heat and cold. Partially, it is basically due to the three things: due to the toxic diabetic metabolism, due to endothelial dysfunction, and due to vascular inflammation. So ये सारा जो ड्यू टू हाइपरग्लाइसीमिया बेसिकली हो क्या रहा है, एक तो टॉक्सिक डायबिटिक मेटाबॉलिज्म जो है वो होता है, उसके बाद ड्यू टू दिस टॉक्सिक प्रोडक्शन, टॉक्सिन प्रोडक्शन, डिक्रीज नाइट्रिक ऑक्साइड सिंथेसिस, देयर इज एंडोथेलियल डिसफंक्शन. व्हेन देयर इज एंडोथेलियल डिसफंक्शन, then this lead to vascular inflammation, and this vascular inflammation will lead to decreased blood flow to the peripheries. तो वो peripheries में जो है वो blood flow जो है वो आपका वो decrease करता है, जिसकी वजह से आगे जो है वो axonal और neuronal जो है वो damage होना शुरू हो जाता है, जिसकी वजह से neuropathy जो है वो develop होती है. So this is again the same thing in a different way. Due to decreased blood flow, there is involvement of the vasa nervosum. These are the nerves which are these are the blood vessels which supply the nerves. So when there is decreased blood flow to the vasa nervosum, there is damage of the myelin sheet. When there is damage to the myelin sheet, there is exposed nerve fibers. Nerve fiber जो है वो expose हो जाते हैं, and then there is ultimately formation of the diabetic neuropathy. About the classification of the diabetic neuropathy, there is peripheral neuropathy, in which there is involvement of the hand and feet, tingling sensation. Okay. Then there is proximal neuropathy, when there is involvement of the buttocks. Then there is the focal neuropathy, and finally there can be an autoneuropathy. Focal neuropathy में single nerve involvement होती है. There can be an involvement of the any single nerve due to the diabetes. Then we have the autonomic neuropathy. ऑटोनॉमिक न्यूरोपैथी में अमूमी तौर पे ब्लैडर इन्वॉल्वमेंट है, आपका जीआईटी इन्वॉल्वमेंट है, डिलेड आपकी गैस्ट्रिक एम्प्टिंग है. उसके अलावा समटाइम इट हैपेंस दैट देयर इज इंक्रीज्ड मोटिलिटी ऑफ द इंटेस्टाइन. सो दीज ऑल लीड टू ड्यू टू द बेसिकली डायबिटिक न्यूरोपैथी. देन what are the symptoms and signs of the diabetes neuropathy? So the symptoms of the diabetic neuropathy are very wide range. They depend entirely कि कौन सी nerve जो है वो involve हो रही है. So depending upon the involvement of the nerve, there are sensation of the numbness, tingling and pain in the स्पेसिफिक एरिया जिसकी नर्व जो है वो इन्वॉल्व है, ठीक है। अमूमी तौर पे यहाँ पे पेरिफेरल न्यूरोपैथी होती है, मोस्ट ऑफ द केसेस में देयर इज पेरिफेरल न्यूरोपैथी, सो इन्वॉल्वमेंट ऑफ द फीट एंड हैंड्स इज मोस्ट कॉमन, और उसमें सो उसमें जो है वो नमनेस, टिंगलिंग और पेन सेंसेशन जो है वो होती है। देन द सिम्टम एंड साइन में दो तरह की मेजर सिम्टम है, आइदर देयर इज negative symptoms or there are positive symptoms. Negative symptoms में there can be hyposthesia, hypoalgesia, ठीक है, so in which there is reduced perception of the non-painful stimuli and reduced perception of the painful stimuli. Then there are positive symptoms in which there is increased sensation of the pains or sensations. There can be spontaneous pain, paresthesia, there can be a proximal pain sensation, there can be superficial pain, there can be hyperalgesia and summation can be there. So these are the there can be, so in a nutshell there can be a negative symptoms, there can be a positive symptoms. A negative symptom में जो है वो reduced perception है और reduced pain perception to the reduced perception to the pain or heat, while there is an increased perception can always also be there due to the diabetic neuropathy, and it is the most common form of the neuropathy. So diabetic peripheral neuropathy is basically after the it is the most common form of the neuropathic pain. The second most is the post-herpetic neuralgia, while the most common neuropathic pain feature is the diabetic neuropathy. So diabetic neuropathy की वजह से जो pain होती है, it is the most common form of the pain. So now the diabetic neuropathy checklist, we can prevent with this neuropathy with the blood glucose control, we can screen with the monofilament or tuning fork, and ultimately we can treat the pain symptom with anticonvulsant or any other drugs, antidepressant or the methicobal or these things. Okay, so we can prevent, screen and treat. These are the line of the checklist for us. Okay, so that we can prevent, we can screen and we can treat the diabetic neuropathy. So vitamin B12 or iska, why it is important for the nerves. So coming toward this thing, vitamin B12 no doubt is the most important vitamin for the health of the nerves. B12 deficiency, बहुत से articles में भी और बहुत सी researches में भी it is now established that it is the deficiency of the vitamin B12 can inflict the severe damage to the nerves and can cause them to the malfunctioning. ठीक है, the other benefits of the vitamin B12 is that it can protect and regenerate the nervous system of the brain in number of the ways. ठीक है, vitamin B12 supplementation shows a very progressive results in different researches. So it is well established that the vitamin B12 is a very important for the overall health of the nerves. So it is essential for the overall health of the nerves. So methylcobalamin, why it is important for the recreation of the nerves or regeneration of the nerves? Basically what happens, the acetinosyl methionine, as we all know, is an donor of the methyl group to our body. So it is acetinosyl methionine is basically needed for the methylation of the myelin based protein. So myelin based protein जो कि which plays a very important role in creation of the myelin, so उसके लिए acetinosyl methionine is needed for the production. So when there is deficiency of the vitamin B12, there is deficiency of the acetinosyl methionine. When there is deficiency of acetinosyl methionine, this ultimately leads to the impaired production of the myelin sheet. So myelin sheet की production जो है due to B12 deficiency जो है वो impaired हो जाती है. If we are deficient in either vitamin B12 or there is damage to the myelin sheet, और अगर पहले ही damage, for example due to diabetes there is damage to the myelin sheet, so उसकी repairment के लिए भी आपको there is need of acetinosyl methionine. और acetinosyl methionine की production में जो विटामिन B12 है, it plays a very vital role. It plays a role as a coenzyme. ये coenzyme के तौर पे उसमें role play करता है. Similarly, for the production of the lecithin, which is also an important component of the myelin sheath, the vitamin B12 is necessary for the production of the lecithin as well. So, if there is deficiency of the vitamin B12, there is impaired production of the lecithin, there is impaired production of the acetylmethionine, which ultimately leads to the impaired production of the myelin sheaths. So this is a diagrammatic representation of all this. So during the process of the myelin sheath, there is this is PCA cycle में से. So when there is propionyl CoA is formation, when there is methyl malonyl CoA is produced, the vitamin B12 act as a coenzyme there. ठीक है. So when propionyl CoA is converted into methyl malonyl CoA, वहाँ पे भी ये vitamin B12 जो है वो as a coenzyme act करता है. And when there is methyl malonyl CoA जो है वो succinyl CoA में convert होता है, तो वहाँ पे भी जो है वो vitamin B12 act as a coenzyme. So this ultimately this whole process continue, or ultimately this will be converted into palmitoyl CoA, which is converted into sphingosine, or this sphingosine will certainly form the myelin sheath. Or when there is decreased production of there is decreased level or deficiency of the vitamin B12 in our body, so there is decreased production of the propionyl CoA, methyl malonyl CoA, which will lead to abnormal production of the myelin sheath. Or if there is already damage to the myelin sheath, there will be no repairment of the myelin sheath due to this. Then vitamin B12, why it is necessary? Early detection vitamin B12 deficiency is very important because at early stages we can treat it. In the late stages, this sometimes it leads to the unrepairable damage. So we need to early detect this vitamin B12 deficiency. So if there is a deficiency of the vitamin B12, so there is production of the neuropathy or damage to the nerve cell. So early detection जो है वो बड़ी important है for the repairment. लेकिन features क्या हैं early detection के लिए? आपको पता होना चाहिए किस तरह हम detect कर सकते हैं. So there are certain neurological symptoms are associated with the B12 deficiency. For example, there is unpleasant sensation on the skin, there is numbness, tingling sensation, the constant pin and needle sensation, chronic nerve pain, there can be, and in a severe case there can be a paralysis. So early detection is very important for the treatment of the neuropathy. So if there is a neuropathy, you need to recognize it earlier. Okay? Because in the advanced stages, there can be peripheral neuropathy, polyneuropathy, funicular myelinosis, combined nerve degeneration जिसे हम कहते हैं. ठीक है. So combined nerve degeneration can be there. So it is also associated with the different other diseases like Parkinsonism disease or multiple sclerosis. So vitamin B12 and diabetic neuropathy, इनका आपस में role क्या है? So nerve damage is also a frequent consequences of the diabetes. About 1 in 3 diabetes patients develop diabetic neuropathy, and in most cases the peripheral nerves are affected. So vitamin B12 deficiency में भी आपके पास क्या हो रहा है कि आपके पास nerve damage हो रहा है. ठीक है. और दूसरी तरफ आपके जो diabetes है, long standing diabetes, वो भी ultimately जो है वो neuropathy cause कर रही है. और इन दोनों को vitamin B12 का रोल यहाँ पे बहुत ज़्यादा prominent हो जाता है. The successful therapeutic agent in the diabetic neuropathy, oral supplementation हो या injection हो, they are proven to be very effective. ठीक है. So to decrease the tingling sensation, pain and discomfort जो है वो उसको decrease करने में there is a very important role of the vitamin B12 in decreasing the this pain and tingling sensation of the due to the deficiency of the vitamin B12. So there is a trial which is being indicated that the supplementation with the vitamin B12 is very important and it proven to be very helpful. For example, it decreases the pain sensation it also increases the nerve conduction velocity in nerves. ठीक है, so they have tried that 5-month trial था ये, जिसमें initially 3-month IM injection 3 times per week जो है उन्होंने इंड्यूस कराया. Then in a second phase 2-month tablet 3 times a day जो है वो patients को दी गई, and it has been observed that there is 34% increase in the nerve conduction velocity and there is 52% reduction in the pain source, the pain score. ठीक है, so mecobalamin is playing a very vital role, which is being established by the different studies as well in the reduction of the pain score as well as in the conduction of the nerve velocity. So there are certain types of the methylcobalamin are available. Okay? So vitamin B12 methylcobalamin is accounts for the 90% of the B12 in the spinal cord, which ensures its importance for the nerve tissues. Here is a trial which is been available with reference to our society, that which is conducted by the Zahid Mia and Nazish Waris of the Bakai Institute of Diabetes. So they have seen the association of the vitamin B12 deficiency in people with type 2 diabetes with metformin and without metformin. Okay, and this research is conducted in our Karachi setup. Okay, so what was the conclusion? Conclusion was that there is the B12 insufficiency was frequently found in our population and may progress to B12 deficiency. It is also associated with the neuropathy in subject on metformin, and further interventional studies are assessed to benefit the vitamin B12, that it also reduces the painful neuropathy in patient with metformin may be warranted. Okay, so they have established that there is decreased level of vitamin B12 in our society, और जो कि अगर supplementation of the vitamin B12 will lead to improvement of the nerve conduction velocity as well as the pain sensations. There are neuropathic pain management. What are the goals of the neuropathic pain management? We need to treat and prevent the recurrence of the pain causing condition. This can reduce pain, this can improve the physical and psychological function, and this can improve the quality of the life. So thank you very much.
Thank you very much, Doctor. They will definitely, जो आपने अभी discuss किया है, तो they'll surely get some insights on this. So I'll formally open the session for question and answer. अच्छा डॉक्टर साहब, सवालात आना शुरू हुए हैं. There is one question from Mr. Ahmed that what is the ideal and effective combination to treat drug-induced neuropathy having long-term treatment specifically due to anti-diabetics?
एंटी डायबिटिक में जो मतलब अमूमी तौर पे हमारे यहाँ जो है वो मेटफॉर्मिन इज रेगुलरली यूज्ड एज एन एंटी डायबिटिक ट्रीटमेंट. तो उसमें अमूमी तौर पे हमने जो अभी मैंने स्टडी का जिक्र भी किया था, फॉर एग्जांपल इन दिस which is being conducted in the Karachi by the Zahid Mia. So they have studied that due to metformin there is decreased level of the vitamin B12 is there. So effectively the combination की अगर मैं बात करूं तो सबसे पहली बात ये कि you can give the vitamin B12 supplementation जो है वो improve करेगी आपकी nerve regeneration को भी, ठीक है, और conduction velocity को भी. So vitamin B12 is necessary here. और उसके अलावा फिर आपके पास options हैं कि आप जो है वो for example pregabalin वगैरह में से choose करें कोई, ठीक है, और उसके बाद जो है वो आपके पास जो है वो duloxetine वगैरह की option जो है वो present है. So gabapentin उसके अलावा pregabalins में से, और उसके अलावा जो है वो आपके पास जो है option it depends upon the पेशेंट टू पेशेंट जो है वो थोड़ा सा वेरी करता है. तो लेकिन विटामिन B12 प्लस जो है वो आप उसमें से जो है वो फॉर एग्जांपल प्रीगैबलिन और gabapentin would be the ideal combination, but I will say.
Okay, thank you very much.
Dosage and duration of the methylcobalamin in diabetic neuropathy. I will start with the 500 BD. So I think so. Okay, this would be a good initial dose for the diabetic neuropathy.
Thank you very much, Dr. Saab. We'll just wait a couple of seconds more. In the meanwhile, I'll just share with you कि Facebook पे भी session जब live हुआ है तो there have been almost like around 45 to 50 participants who've listened to that lecture over on Facebook as well. तो माशाल्लाह से काफ़ी अच्छी participation रही है डॉक्टर साहब. एंड पार्टिसिपेंट से रिक्वेस्ट है कि अगर मजीद इनके कोई सवालात हैं जो अभी यहाँ पे एड्रेस नहीं हो सके, आप अपने क्वेश्चंस क्वेरीज जो है हमें ईमेल कर दें तो वी कैन ऑलवेज फॉरवर्ड देम टू डॉक्टर साहब एंड गेट एन आंसर फॉर योर क्वेरी. ठीक है डॉक्टर साहब, लेट्स मूव टुवर्ड्स द कंक्लूजन ऑफ द सेशन.